Hi guys, this is Henry Hoffman. I'm an OT and co-founder of Saebo. Welcome to my Q&A series where therapists send in questions in hopes of helping them out and giving them a few tips. I have a good question from an OT today about the SaeboFlex versus the SaeboGlove, and it reads, what is the difference between the SaeboFlex and SaeboGlove, and how do I choose for my clients? And that's a very good question. I'd like to take a step back and discuss why these products exist and who are they used for. When you think of neuro clients, you typically think of spinal cord injury, brain injury, and stroke. These patients typically lack finger extension. They need some mechanical assistance to open their hand. If you want to have function at all, you're going to need some assistance. Without this assistance, you're going to be living a one-handed life as a client typically. With respect to the SaeboFlex and the SaeboGlove, both devices assist with hand opening, and both devices are finger extension assist products. However, the main difference is based on the amount of spasticity the client has. If the client has high tone or a lot of spasticity, then a SaeboFlex would be more appropriate. That device is metal hardware base. It has springs to assist with opening the fingers. It's an outrigger style device. It's very rigid and durable. And it has digicaps to block the DIP joint from bending. So you're going to want to have that extra support, and that's what the SaeboFlex does. If the client has very low tone, less than mild tone, then you'd go with the SaeboGlove, which is used primarily for patients who just need a little help to opening the hand. Their hand is floppy or weak or very flaccid. So you can use a garment-based type of glove and have elastic tensioners to assist with opening. And that's a really good splint. It's used for a lot of patients who are on the low tone side. If you have someone on the fence in between a SaeboGlove and a SaeboFlex, oftentimes you can use the SaeboGlove and then use electrical stimulation. I'll put the eStim on the finger extensors. I'll use my Aviva stim with a trigger button. So when they go to drop the object, I'll hit the trigger button to get this stimulation while wearing the SaeboGlove. So the combination of electrical stimulation and mechanical assistance is great. So I can use both of those together if they have a little tone and they're in between the SaeboFlex and the SaeboGlove. Don't forget, you need to look at the product selector on our homepage. If you're ever trying to figure out which product's most appropriate, go to the homepage, hit the product selector. You can put in, do they have tightness? Can they squeeze? Can they open? And it's going to help you figure out if they need a flex or a glove or any other products that we have available. And remember, the bottom line here as a clinician is you're going to have to provide some mechanical assist. You have splinting skills. We've learned it in school. We do it in the clinic. If they can't mobilize or move their limb, we're going to help them facilitate that movement, usually with some type of splint. And the key to remember is if they have spasticity and they don't have finger extension, then you're going to really decide, well, how am I going to best put their hand and wrist in a functional position so they can do grasp and release? And that's where the SaeboFlex and the SaeboGlove really come in. So I appreciate you listening today. Stay tuned for more videos. We're going to keep rolling this out. We have lots of questions from therapists. And always remember, no plateau in sight. Always keep that in mind with patients' recovery. Oftentimes they're hit with that plateau word, which we think is unfair and immoral. We don't think the patient plateaus. We think our treatment options have plateaued them. So keep that in mind as you think about your next neuro patient. No plateau in sight. Thank you. Take care.